Coming up, we'll be on location at Sweet Smiles Dentistry in Falls Church, Virginia, discussing the latest advances in dentistry and how they can help you achieve that beautiful smile and improve your oral health with one of this area's top dentists, Dr. Ramineh Kangarloo. Welcome, Dr. Kangarloo, to the Top Doctors Interviews program.
Thank you very much. It's my pleasure.
All right. You're recognized as a top dentist throughout the Northern Virginia area. You have a really patient-centric approach where you put the patients first. You really care about your patients, and we're going to speak with some of them later as well. Your practice is equipped with some of the latest technology in dentistry as well, just to create a wonderful experience for your patients. Can you tell us about your vision for your practice?
See, one of the things that I realize is that a lot of people, they have anxiety. They don't like to come to the dentist. So what I wanted to do is to create a dental home for my patients, that not only they come to the environment that is friendly and happy, also is convenient as well. Because we brought several specialists under one umbrella too. So our patients, they don't need to go to different offices. And at the same time, our team are really caring for our patients. They go out of their way to help me to be able to provide the treatment to our patients. So this is very important for me, knowing the fact that I can change those visions that people have about dentists, the dental work, and all of that.
Yeah, dental anxiety is something that so many people suffer from, whether it was an experience they had as a child where they went to the dentist and it was either some discomfort or it was a sterile environment. You've created a beautiful, relaxing atmosphere at your practice that really, right when you walk in, relieves any anxiety.
So as you notice, our practice is actually in a single home. We have a backyard too. So this whole thing, it brings that hominess to our patients, so they don't feel that they are in a doctor's office and I have to be afraid, and the blood pressure goes up and all of that.
And then when you combine that beautiful calming environment with your personality, your warmth, I think it really takes the patients to another level of relaxing and feeling really comfortable.
Right, because our goal, all of us, from, as I mentioned, our assistant, hygienist, front, everybody, is that we try to get to know our patients. We know that we are treating people, we are not treating teeth. So for that reason, we want to get to know them. We always talk to them. We find out that what was their past experiences, what is their expectations, what is the source of their fears, because these are the most important one that when it comes to the treatment. If I cannot have a calm patient on my chair, a person that can trust me, I cannot treat them.
I think that partnership that you build with the patients is really critical to achieving the best outcome, because then they really trust you based on your tremendous background, your credentials, and your bedside manner. I mean, it's second to none.
Right, and that's what I love to do. I love to take care of my patients, not only dental related. There are cases, our patient, they come in, they have personal issues maybe, and all of a sudden they cry on the chair. So I would sit with them and I would listen to them and I would sympathize with them. So it's a different approach that we have at Sweet Smile Dentistry.
I love it. I mean, it's like a family member or a friend.
Very true. They are our family. My staff is my family. I treat my staff just like my family as well. I celebrate with them. I celebrate with our patients. So it's great.
There's been so many advances in dentistry over the years, and it's really taking it to the next level as far as the outcomes for patients, the patient experience as well. Can you please tell us about some of these advances?
So one of the most popular treatment that we do at Sweet Smile Dentistry is porcelain veneers. With the porcelain veneer, we are able to, modify the shape, the size, the color of the teeth, and give our patients the smile that they want and they enjoy. another one of our popular treatments, of course, is Invisalign, which is done by our orthodontist. And that day, when patients finish the treatment and they smile to get their pictures done, that is the moment that we really enjoy. With veneers and porcelain crowns, sometimes the patient right at the chair, they take a picture, they send it to their spouse, they send it to their, to their family, and they are so happy.
You're actually changing lives, because when you help people feel more confident about their smile, it carries over to the rest of their health and wellness as well.
Of course, and not only that, it increases their self-esteem and self-confidence, and that's something that I love to see.
And what are some of the key problems that you address with dental patients here at your practice?
So what we see is that the limited knowledge about oral health in general. They don't even know that the oral health is part of a general health. When we bring up questions, when we ask them about medications, or we even say we need to consult your physician, they're like, "You're not doing anything. You're just working on my teeth." I'm like, no, this is what we try to do for them. We try to educate them how to take care of their oral health. We try with different things, with pictures, with x-rays, even a simple mirror. So this way they can see it and they can relate to it, besides the fact that they would be like, oh, this is what they are telling me and they are dictating me what to do. We want our patients to know reasons. When they know the reason, then treatment is easier and they can educate other peoples in their families too. We have parents, they come in, they have little kids. A mom would come in with a mouth full of decay. So when we talk to the mom, we would find out, they drink a lot of sodas, a lot of, carbohydrates, and they don't brush well. So we even go further and educate the mom what to do with her child, which this way, not only mom knows what to do now, knows what to do with her kid as well. And we haven't even seen the kid, but we tell the mom what to do.
That's a really great approach. It's a partnership with the patient. By educating them, they're really understanding what you're doing, why you're doing it, and how to maintain it as well.
Right. And then this way they don't feel that we are dictating anything to them. They would volunteer for it. When I give options, they're like, no, then I want this option. Because I tell them, look, this is the picture of your tooth. This is the reason. So they'll be like, no, I wanted this one, the one that is better. We don't have to sell treatment. This is the key. We don't have to sell it. They accept it without us telling them.
I love that approach. It's really, as I mentioned earlier, patient-centric. It's putting the patient first.
Right.
And really identifying their needs and not trying to push a treatment onto them, but really seeing what they need and then educating them so they understand the benefits for their health, their dental health, and their wellness.
Right.
Your practice is full-service dentistry. You have professionals working here at different specialists like orthodontists, like you mentioned, and other types of specialists here. So it's really a one-stop dental practice. You don't have to go anywhere else.
Right.
What are some of the key treatments that you offer here, Doctor?
So with our periodontist, basically the implant placement is one of the most important treatments that he performs. Patient, when they come in and they are suffering from missing tooth, especially let's say in the front. So our periodontist is able to place an implant and I would restore the implant. Our orthodontist does the traditional braces, also Invisalign, for adult and children. We just had the patient who finished the ortho treatment, and I believe she's in her late 40s or maybe 50s, early 50s. She felt great. She even stand in front of the sign, got her picture done with a big smile. Our endodontist is helping us to get our patient out of pain. And he's wonderful because sometimes he is not here every day. I call him and I tell him, our patient is in pain. Can you come sooner? Can you see this patient sooner? And he's always willing to come and, take care of the patient. And you know, the other treatments that we do here, it's we use veloscope for our patients. Oral cancer screening is one of the main things that we do for all of our patients. With the veloscope gives us the ability to see abnormalities in a soft tissue, which we cannot see it with the naked eye.
Which is really important because prevention is the best form of medicine. So if you can see it with the veloscope, or identify that issue before it becomes an issue, you can really treat that problem.
You know, based on American Cancer Society, they said that in this year around 53,000 people will get diagnosed with oral cancer, and around 11,000 will die from it. So we as a dentist, we have this ability to diagnose, not necessarily diagnose the type of a cancer, but diagnose the abnormality in the soft tissue. So why not doing it?
I think that's very important for viewers to know that, diagnosing and identifying it in that preventive manner is so critical.
Of course. That's very important.
All right. There's so many patient benefits from having a collaborative approach to dentistry by having the different specialists all under one roof, as compared to going to an orthodontist at a different practice, an endodontist somewhere else. By working together as a team, you're able to really identify the problems, consult with each other, and put together the best plan for each patient.
Absolutely, because what we do is that, number one, a patient has one chart. Let's start from the very basic. It's not different practices. The doctor, the specialist from this practice doesn't know what the specialist in the other practice do. So here, the patient has one chart, and all the specialists, they communicate. As simple as this, when I see a patient, for example, if it needs a root canal, I just take out my phone, take a picture of that x-ray, and I just send it to our doctor for any recommendations. Right there, I get a recommendation and I tell the patient what to do. And or if one of our specialists, is actually working, is in the office, and I'm there, and they have a question from me, they just pull me over, I would look and I would tell them what I would do too. So this communication and this work that we all have together is the best thing that we bring to the patient. First of all, the patient already knows me, knows what I do, trust me. So that trust is kind of carried to the specialist too, because they know we work together.
Having that collaborative team approach is so beneficial to the patient. It's going to result in much better outcomes, more precise outcomes, and a healthy and beautiful smile.
Absolutely.
All right. Dr. Kangarloo, what type of results are your patients seeing from these treatments?
They get the very great, I don't want to say great and fabulous, but they are very happy with the results. If any of our patient is not happy with anything we do, we always offer them different options, And this way, we make sure that they are happy, because what we do in their mouth, we want it to last for a very long time. And that's the reason the way we do it.
Dr. Kangarloo, what are some of the key benefits of Invisalign compared to the traditional braces that we're all familiar with?
So adult patients that they are seeking orthodontic treatment, they don't want to have traditional braces majority of the time, because maybe one of the reasons would be that it would remind them of their teenage years, and nobody wants to go back that far. So Invisalign would give opportunity to our patients to get their dentition to the correct positions, enhance their smile without even anybody noticing. Invisalign is a series of trays or aligners that the patient would wear for 2 weeks for a certain amount of time that gradually will move teeth and bring them in the correct positions. So this way, they can get the treatment they want, they can have a smile they like, and not only that, nobody would know.
That's a huge benefit, especially for the busy professional that has to speak in front of groups or at meetings and things like that. When you see the braces, and I know they're very beneficial and they help people, But to have the option of having clear aligners that people can't see, I think it's a no-brainer to go that way.
And teenagers, they want it too. My daughter is asking me for that for Invisalign as well now, and I'm letting her know that she has to wait a little bit.
There's so many benefits from Invisalign, whether it's for adults or teenagers. You know, the fact that they are clear, people don't know they're wearing them. Are there other benefits as well, Doctor?
For Invisalign?
Yes.
Of course, because Invisalign, when we bring teeth to the ideal positions, it would make the oral hygiene and brushing and flossing even easier. So when we have the crowded teeth, there are areas that the plaque and calculus will accumulate because a patient cannot reach it. Now, when we bring all of them in a correct position, it's much easier to brush, to floss, and keep it clean. So overall, it would help our patients to keep their teeth for a much longer time.
And you also do dental implants here for people that are missing teeth, and there's so many people that have missing either one tooth or several teeth. What types of options do they have with dental implants?
With dental implants, our periodontist places the dental implants. It can be a single implant just to replace single tooth, or it can be a bridge over implants. So this way it doesn't need to be every individual tooth that is missing does not need to have the implant.
And who's a good candidate for dental implants? Is it something that anyone with a missing tooth can get?
Not necessarily everyone with a missing teeth can get implants, because to place an implant, we want to make sure that there is a sufficient bone that would hold the implant in place in a basic way. Okay, so if a patient has been missing teeth for many, many years and there is no ridge to place the implant, it would make it very difficult for the implant to work. Or there are some patients that they are on certain medications, like a bisphosphonate medications, that could have some effect. Not necessarily they cannot get implant. However, there is going to be some type of challenges involved.
So if they're missing teeth, it's best to set up a consultation to come in and see if they do qualify or are candidates for dental implants.
Exactly, yes.
And how long do dental implants typically last?
The dental implants last a very, very long time. However, just like tooth, patient needs to take care of their implant as well. Again, brushing and flossing is very important to make sure there is no plaque accumulated around the implant and cause the inflammation around the implant and failure of implant.
So it's like getting your natural tooth back, because you have to maintain that the same way you would when you have the implant.
Absolutely.
And there's so many benefits, because you can now eat the foods that you always wanted to eat. You can have that beautiful...
You can chew.
Yes, you can chew as well.
And that steak that you wanted to chew all the time, you can do it now.
It's really like getting your life back.
Absolutely, yes.
All right. Dr. Kangarloo, you also mentioned that you do veneers for people to help regain that beautiful smile. Can you tell us how that works?
Basically, with the veneer, we are able to enhance the shape and the color of the teeth and bring them to the nice smile. So with the veneer, we do the minimum reduction of a tooth structure only on the front area, not the whole tooth. Impression is taken, the veneer, which are porcelains, they will get fabricated, and then when we receive it from the laboratory, we will cement it with a permanent cement. So this way, they will be able to smile again.
So Dr. Kangarloo, who's a good candidate for veneers?
Basically, anybody can get veneers. People that they have chipped teeth, maybe their teeth is a little cracked, or they don't like the color and the shade of their teeth, or there are some spacing between their teeth and they want to close it. However, they don't want to go through the whole orthodontic treatment. They would be a good candidate for the veneers. However, in some cases, there could be some limitations that we would address that in our consultation appointment.
And what type of results are your patients seeing from the veneers?
They love their smile. When we cement those veneers, they actually get so excited, they take a picture, and I've seen it that right there, they even text it to their spouse or their family.
And what's the patient process like? If someone's interested in veneers and they come in, what can they expect?
So First of all, we see patients for consultation first. We need to know what is it they don't like about their smile. If I don't know that, I can't help them. Then series of pictures will be taken, and then we will do a wax up, which is basically what we would anticipate the veneers to look like. We will show it to the patient. We make sure all their concerns are covered, and then after that we will start with the treatment.
Well, that was very informative, Dr. Kangarloo. You're doing great work here, not only the Falls Church community, but you have patients coming from throughout Northern Virginia, DC, and Maryland, and all around, because you are so wonderful with your bedside manner. People really feel your care, and your approach to dentistry is unparalleled in this community. So I want to thank you so much for joining us and being a guest today.
Thank you very much for having me here today.
It's our pleasure.
I came here for my teeth to be worked on and put braces on them so I can smile more. Well, she's nice, kind, friendly, sweet, and smart, and beautiful. I love her a lot because she's a very gentle person, and I really love her. She's a good dentist, worker on my teeth, and she's also doing her work here for us. She is so amazing. I'm a beautiful, good-looking young woman, that's why. She's nice, as I said before, and I think we should work on more teeth on more people for their smiles. Girls, of course, and boys as well. So she can help them to smile more, like me.
The first time I saw Dr. K, I didn't really have any problems that I was experiencing, but I knew I needed to have dental work done. I had a fear of dentists, and so I hadn't been to the dentist for a while. And working with Dr. K was great because she was able to get hospital privileges and did all the dental work I needed to have done at the hospital the first time through. So the treatments I had with Dr. K started with replacing some of the old fillings from my youth, and then taking care of some other work, like I think there was a root canal maybe that was done, and the removing the old fillings. So my family and I have been seeing Dr. K for years now. That's why it gets a little difficult to remember what I've had done in the past, because we've been coming here so frequently. I find that Dr. K has a very calming effect on her patients. I've always been anxious about the dentist, and I no longer am, and one of my daughters used to be afraid to go to the dentist too, and now she comes here no problem at all. So that's been great, and working with the staff is wonderful. They're kind, they're patient, they're proactive and responsive, and we've had a lot of different treatments done while we've been coming here. I recommend Dr. K all the time to my friends as well as to my clients. I work at the ARC of Northern Virginia, and we advocate for people with disabilities. And so actually several of our trust clients come here to see Dr. K as well. Dr. K took part in some grant programs we had, training dentists and their technicians and staff to work with people with disabilities. So I'm comfortable referring people to her. And then my friends as well, so they all know about Dr. K too.
They always clean my teeth. They brush, rinse, suction wash, and they do sorts of things, like checking my mouth to make sure there is no abscess or blood on it. She is very smart and clever. I do like the hygienist. I did tell the staff about the dentist because I have been there since I get to have my teeth cleaned as well. She is very smart and a clever person. I like the dental work. I only told my staff. I really love having here because I love seeing Dr. Kangarloo because she is very good at helping me with my teeth.
I was referred to Dr. K by my main treating physician, Dr. Moya. She had recommended Dr. K when I had told her that I had thought about doing the Invisalign, and so that was my referral was to see Dr. K for the Invisalign. About, I want to say 4 or 5 years ago, When I first came to Dr. K, she had mentioned that as she was doing my initial check, she saw some things that I needed to have done, like cavities and little other minor things. She said I couldn't have the Invisalign done until I had those things done, like cavities and whatnot, taken care of. And so I want to say the Invisalign started about 2.5 years ago, and then COVID started. And so basically 2 years that I have not been using the Invisalign, so I just recently have come back to see Dr. K. Well, I had braces as a teenager, and I noticed that my teeth, the upper teeth, started bucking out somewhat, and so I wanted to get that fixed, and that was the impetus for coming to see Dr. K. Dr. K, just coming to her the first time, she just put me at ease in the room, doing the initial procedures for the cavity fillings, necessary, putting the Novocaine in my gums. She just has a manner with patients. It's just soft and calming. She puts music in the room for that, just to make you at ease. So that's one of the things I enjoy about coming to see Dr. K. She always has a smile on her face, and just, you can see that she loves her profession and she loves her patients. It's working great. I've noticed a change in the structure of my teeth, where they're coming in line again. Again, it's every 2 weeks I come back to get the new tray of Invisaligns, and she keeps the old ones in case I ever lose them. But no, it's been great. I mean, the first tray is always the hardest tray to get used to the first couple of days, and then it's like nothing. It's like just usual, but it's all good. The braces, the original, were the gray track ones, the metal ones. Oh my gosh, they hurt so much. They were very hard to, when I would drink something cold, my teeth would just hurt so much with the original tracks. But with the Invisalign, I can take them out when I eat or drink, brush my teeth, put them back in. It's just very convenient, especially when I'm working. So I have a little case to put them in, so if I'm working, I can take them off and put them back in after lunch. Oh, they're awesome. You can't really tell. You can't really tell you have Invisalign. Like, nobody at work has noticed it or said anything to me, so no, it's awesome. I do enjoy using Invisalign. I highly recommend Dr. K to anybody because of her bedside manner, the way she treats patients, the smile on her face. She's one of the few dentists that I've known in my lifetime that I enjoy coming to see. I'll call her office and schedule an appointment, and the gentleman that always picks up the phone, he recognizes my voice. He said, "Okay, Catherine, hold on, if we need to rearrange our appointments." They're just very welcoming. Again, always a smile on her face every single time I've seen Dr. K. She's just awesome.
I had an old filling that unfortunately my previous dentist had done an overlay on. The overlay had a crack in it, and so Dr. K was like, "We are going to have to do a crown." And so that's what we did. We did a crown. We did a prep one day and then came in for the delivery a couple of weeks later. And basically I was kind of worried because I've never had a crown before. And this was probably one of the easiest things that I've had done on my teeth. So very grateful for that. She is a delightful doctor. I actually have recommended many people for her, people who have a fear of dentistry. So she's very light touch, very gentle, and when you're in her chair, you feel like she cares. It just comes through everything she does. The smile is great, and I get a lot of compliments on it. My orthodontist was also very good. But Dr. K maintains the smile for me, so I'm very happy. I actually recommend her to many people, including some family members who come here because of that, because of the way she manages her practice and because of the way she is with her patients. She's got great chairside manners.